There are approximately 200 diseases that can be transmitted from animals to humans. Swine flu ordinarily occurs among just pig-to-pig transmission. Occasionally we will see a case where someone who works on a swine farm, for example, may become infected. What is unusual about this occurrence is that it very rarely transmits from human to human. And it is occurring now, and that means that the virus has mutated. And so now it can be transmitted to humans, and it's doing so at a rather rapid rate. This is a new strain, so most of us don't have any immunity to it, and so it probably would not affect their immunity. It's too early to tell. We've heard about the deaths in Mexico, for example, but what we don't know is how many cases were of a milder form that haven't even been detected there or here. So it could be that it's much more prevalent than we even think it is, but the cases have been milder and therefore haven't come to anyone's attention. They've just treated it like ordinary flu and have recovered. So it's really hard to tell. It does mutate. And again, sometimes in infectious disease we see that it actually gets weaker and not as severe as the original illness. The modern airplane, they use HEPA filters, so it's probably the best filters that we have available. But you're right. Ordinarily, the airflow is across the cabin, so you're more likely to catch something from someone sitting right around you than it would be from front to rear or rear to front. The best thing to do would be to check the cdc.gov website, the Center for Disease Control website. They're constantly updating alerts for travelers. At this point, they're only cautioning against unnecessary travel to Mexico. There has been so far no restrictions or advisories about travel within the United States, and I myself am getting on a plane tomorrow. So. Well, some schools, as you noticed, are closing schools. Because like yesterday in Fort Worth, Texas, they closed the entire school system there as a precautionary move because they'd had some confirmed cases occur there. Most schools are not closing at this point, but I would certainly inquire with the school's policies, because schools vary from school to school what their policy and how they're dealing with this. I think if they're not doing anything, then I might ask the teacher if I could address the kids and talk to them about how they can protect it and how important it is for them to wash their hands very frequently, and to use disinfecting wipes on the doorknobs and other surfaces that kids are likely to touch and transmit viruses. In terms of washing your hands, the best thing to do is to wet them thoroughly first before you wash them, using at least lukewarm water if you can. And then taking a generous amount of soap and rubbing it thoroughly through both the back and the front of the hand, and in between lacing them, the fingernails. And you want to wash your hands briskly for at least about 15 to 20 seconds, about as long as it would take you, as someone said, to sing Happy Birthday or some other short song like that. And then to, of course, rinse them thoroughly. The other thing is, if you're in a public bathroom or some other facility such as this one, it's also always best to then use the paper towel, perhaps, to open the door or to further contact with the towel dispenser. And that's it. That's all there is to really protecting yourself. Generally, we will pick up the infection because someone coughs or sneezes, and we're within 3 to 6 feet. So the breathing zone is 3 to 6 feet where you can pick up this. But again, sometimes someone might cough, an infected individual could cough into their hand and then touch a debit machine or an ATM machine or a computer keyboard or some other surface, and the virus can live for more than 2 hours on that surface. And then if you come along, you touch the same surface, and then you touch your mouth or your eyes or nose, then you can then pick up the virus that way. I think there's only been, as of this morning, around 8 or 9 confirmed deaths. Confirmed deaths. There's been more deaths than that. But again, they're suspecting that it could be related to the swine flu. The confirmatory tests haven't been done, so we can't really say that many, I think there's been 145 deaths, but again, only 8 have been confirmed related to this disease. It could well be that the individuals that were, the mortality that occurred in Mexico, that maybe it hit people that had other pre-existing conditions that might have been affected as a result of that. And maybe they had already a weakened immune system. It could be that as the disease travels from Mexico to more remote lands, that it's becoming a less virulent strain and milder form of the disease. And again, it could be that in the United States and Mexico or anywhere else, that there are many more mild cases of the disease that haven't been picked up or even haven't even been thought about as being swine flu, so that actually maybe the mortality rate is actually lower than what we think it is. This is a new strain that we've never seen before, and as you know, the CDC, the federal government, is working diligently to try to develop a vaccine to treat this. Generally speaking, most vaccines, it'll take them about 4 to 6 months to develop a vaccine. I think right now they're probably trying to shorten that time frame if they can, but I would say within 4 to 6 months, we hopefully will have a vaccine that will protect us. The current vaccines are not, even the past swine flu vaccine probably would not protect you against this disease. Positive things is that it's occurring as we go into summer. The flu is not as prevalent during the summer, and the concern that some have expressed is we have to watch to see what happens with the swine flu if it hits the southern hemisphere, because they're getting ready to go into their winter, and the disease could thrive there, and they get retransmitted to us during our winter. So that's a concern, and one of the things that we want to do is monitor what the rate of infection in the southern hemisphere. Absolutely. They should take extra precaution. It can have an effect on the fetus. We know that certain groups are particularly vulnerable to severe forms of influenza, and that is usually the very young and the very old, persons with lung or heart disease, diabetics, and pregnant women. And we know from past influenza outbreaks that pregnant women can sometimes experience miscarriages or preterm births. So that's why the Centers for Disease Control has always advocated, or has advocated for quite some time, that pregnant women receive the flu vaccine. Well, certainly they should have a supply of their prescription medications. Let's say if someone lives alone, especially, or gets sick, then it's important that those individuals have a supply of medications to last them through, just in case they were to get ill. Also, probably sufficient food to last them through the period where, for a week or so, non-perishables or other things like that. Because for those individuals, one of the things that we're recommending is stay home so you don't infect other people, but so you don't want to go to the grocery store, you don't want to be going to the pharmacy, so you want to have some supplies if you can, just in case you should get ill.